We've all heard of Lasik eye surgery, but what is it and what does it all consist of? Well, today I'm going to give you more information on this surgery. I'm going to tell you how it is helpful, the procedure, and the outcome of the procedure. To start, what is Lasik eye surgery? Well, Lasik eye surgery is a procedure done by a licensed ophthalmologist to help correct one's vision. It is for people who suffer with dry eyes from contacts or just don't want to wear their glasses anymore. According to Mayo Clinic, some benefits of this surgery include clearer and sharper vision, and that's the main goal with the surgery. The doctors do this by changing the area that light is refracted on in the retina, by changing the shape of your eye. With nearsightedness, your eyeball is too long, it's an awkward length so that the light refracts differently. And with farsightedness, your eye is smaller and needs to be shaped corrected to make the light refract off the right part of your retina. There are two main risks that come with this surgery. There's overcorrection and undercorrection. With overcorrection, the doctors have taken out too much of the corneal tissue and did not shape the eye correctly. According to WebMD, this procedure is not reversible. On the other hand, undercorrection is when the doctor doesn't take out enough tissue or correct the eye correctly. So that means that the patient did not get the satisfaction of the vision that they wanted and will more than likely have to go in for another procedure. According to Consumer Reports, a study was done on 793 patients who had this Lasik eye surgery. 80% of those people were either satisfied or very satisfied with the procedure. That left 20% with difficulties, and the main two difficulties were the over and under correction. Also, according to Consumer Reports, a good candidate for this surgery is anyone who is 18 years and older, in good health, and either has nearsightedness or farsightedness. Next, I will inform you what a procedure consists of. I'll talk about the before the procedure, during the procedure, and after the procedure. WebMD says that before a procedure, the patient needs to go in for a consult. This consult will consist of the doctor evaluating your health, taking a medical history, and performing a few tests, such as the pressure on your eyes and pupil dilation. After, the patient can ask the surgeon any questions they have about the procedure. Some people ask about the recovery or how well their time is going to be and how fast they'll get the improvements. During the procedure, the way the doctor does this procedure is they use one laser to create a flap on your cornea, and they lift that flap, and underneath it reveals the corneal tissue. They use a separate laser to correct the shape of the corneal tissue by either removing it or moving it to make a different shape of the eye. After that is done and the eye is shaped correctly, the doctor will place back the flap and the procedure is done. The recovery time for this procedure is pretty fast. The patient will have blurry vision for the first 24 hours and probably dry eyes, so the doctor will prescribe eye drops. You only use those eye drops during the first week of your procedure. After, in about 48 hours, the patient will begin to see improvements in their vision. The doctor will recommend that they come back in 6 months for a reevaluation to see how well the procedure actually worked. Finally, the outcomes of this surgery are very prominent. Lasik eye surgery helps give people a new life. They don't have to struggle wearing glasses or being embarrassed, and the struggles of contacts are eliminated because they don't need them anymore. This is one thing that's very important to the patient, is picking the right surgeon to do the procedure. There are a few things that they can look at to get the right surgeon for the job. You look at their licensing and their board certification, their referrals from other doctors or friends. Most people refer from doctors because the best way to find out about good doctors is through doctors that you trust. Once all these processes are complete, the patient will have a new life after the surgery because their vision's better and they'll be able to live without those glasses or contacts. It is important to know the sequences of the procedure before you go into it or decide that you want this procedure. It is a major surgery, even though it is a growing and popular one in the US. You need to know about the pre-surgery facts, the during surgery facts, and the post-surgery facts. Out of all the most basic and popular surgeries in the US right now, LASIK eye surgery is a major surgery that most people don't really know a lot about or have all the information. I talked about how LASIK eye surgery helps you, the procedure itself, and the outcomes of the procedures. I urge you to use this information to go and look for more information on it in case I didn't cover anything that you thought was important or questions you might have. You can use Mayo Clinic, WebMD, Consumer Reports, and I also used allaboutvision.com. These websites had created a way for me to find more information on LASIK eye surgery, the helpfulness, the benefits, the disadvantages, and what the procedure actually includes.